Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. We'll be speaking with Dr. Comilla Sasson. She's joining us here as Vice President of the American Heart Association. She's going to talk about the association's newly launched Nation of Lifesavers initiative to double survival rates for sudden cardiac arrest by 2030. Welcome to Health Professional Radio. Dr. Sasson, thank you so much for joining us this morning.
Thank you for having me.
Tell us a bit about yourself and what it is that you're currently involved in.
Sure. So I have actually been here at the American Heart Association now for over 10 years, a decade, and have been working primarily in CPR, so cardiopulmonary resuscitation, and trying to ensure that everyone who has an out-of-hospital cardiac arrest, so if their heart stops outside of the hospital, that they get the most life-saving things that they need right away. So I've been here at the Heart Association working on that. I'm also a practicing emergency medicine physician here in Denver, Colorado, and have done my PhD research actually in cardiac arrest.
We've all seen the movies, the shows, or heard of someone either giving CPR or having to receive CPR. We've heard about many people having their lives saved. Is CPR a difficult procedure? Is it difficult to learn?
It is not. And today, just by listening, you will have at least learned the two really easy steps of how to do something called hands-only CPR, which is really the first part of CPR with breaths that everyone always kind of thinks about or sees on TV. It'll take you 90 seconds, and we'll teach you how to do it.
In 90 seconds, you can learn to save someone's life.
Absolutely. And we know that CPR, what we're going to learn about today, can double or even triple someone's chance of surviving a cardiac arrest event. Really, in those first 10 minutes. So right when someone's heart stops, you've got this 10-minute window really to help save their life. And that's because for every 1 minute that they do not get CPR or have an AED used, their chances of survival go down by 10%. So the vast majority of cardiac arrest survival is dependent upon you and everybody else who's there on scene. It's not the ER doc. It's going to be what happens right away when someone's heart stops. And that's why it's so important for everybody to know this really easy life-saving skill.
Why is it so important for the average person to know how to do that?
The reason it's so important for everybody to know is that the vast majority, almost 3 out of every 4 cardiac arrests are going to happen in the home. So not in the hospital, but in the home. And so that's why it's going to be so important for you, me, and everybody who loves us. I'm going to be a little selfish here and say that, they need to know what to do if something were to happen.
Is saving someone's life with CPR a common experience, or are most people not likely to get that type of attention on the street or in a restaurant?
Yeah, unfortunately, we know that bystander CPR rates have really been in the 40% range for many, many years. And that's why the American Heart Association, along with all of our key partners and stakeholders, are putting out this new Nation of Lifesavers educational campaign to really change that, right? We know that CPR is really important. We know that less than half of the people who have a cardiac arrest right now are having CPR performed. And so that's why the Heart Association is making a huge commitment to say, look, we're going to change this. Because if we can change how many people have CPR performed right away, have 911 called away, have an AED used right away, we know that we can double or even triple survival just by doing some very simple things like that. So that's where it's going to be really, really important, and that's why we are committed to making sure that not just one person, but every person knows what to do if someone's heart stops.
CPR, cardiopulmonary resuscitation. I hear you say AED. What is that?
An AED is an automated external defibrillator. And so when someone's heart stops, what happens is that it normally, the progression will be that their heart will go into a rhythm called either ventricular fibrillation or ventricular tachycardia. So this is kind of a fibrillation, which is basically the heart is quivering. And in that state, if you can get an AED used, so a defibrillator used right away, that can shock the person's heart back into a normal rhythm. And so that can restore blood flow to the brain and all the other vital organs. And so that's why when you hear us talking about, making sure that you call 911 as soon as someone collapses, making sure that you start CPR, and then asking somebody to go get that AED is so important, because we know the best chance of survival is those people that are able to have a shock done within minutes of their cardiac arrest. And so, again, that's why the Heart Association is really not just helping folks learn about CPR, but AEDs, and even helping community organizations and schools and churches and workplaces know what a cardiac emergency response plan is, so that when something does happen, let's say at their work site, there's a plan. People know what to do. Somebody knows how to start CPR. Somebody knows how to call 911, and someone is hopefully running and getting that AED.
What about situations where a person is leery about rendering aid in that way? I heard a long time ago that women are saved more with a heart event as opposed to men, because a man will get up and go to the bathroom, excuse himself, and a woman just lets everybody know, hey, I'm in distress here. Are women or men more likely to receive that care in that public situation? Are there any groups of people that have to wait for EMS?
We know that there are health inequities right now. So people who are Black or Hispanic are less likely to have bystander CPR performed, whether that's in the home or even in public locations. We also know that women are less likely to have CPR performed, and that's because, if you think about it, there's a lot of, there could be fear about, first of all, there's a lot of misrecognition, right? So people don't understand or realize that someone, a woman especially, has collapsed and her heart has stopped. Maybe they think she's just fainted or something else. And so we know that there's delays to calling 911 and recognizing that a woman has had a cardiac arrest event. There's also the fear that some folks have about, oh my gosh, I'm going to put my hands on the chest. I might have to, take off the bra to put AED pads on. And so there's fear of, am I going to do something wrong, or people thinking that I'm doing something wrong, I'm helping. And then, of course, just overall, we know that people sometimes can be afraid because they think, well, what if I do it wrong, or what if I injure the person? And I think the thing I always tell my community members when I'm doing training in the community is, hey, you know what? They're already dead. What you are going to do is hopefully make them undead. And all you're going to do is help them. And I think that's really important for people to know, is that doing nothing, that person will not survive. But if you just do something, that's why hands-only CPR is this really easy two-step thing that people can do. The first step is call 911. The second step is put your hands in the center of the chest, push hard and fast at the rate of 100 to 120 beats per minute. And we've got some songs for you to pick, like Staying Alive and Can't Stop the Feeling by Justin Timberlake. So 100 to 120 beats per minute.
That's it.
That's it. Just learned it.
Talk about some of the dangers of giving CPR. I mean, you are pushing on a person, you are touching a person. Is there anything we should be aware of while we are rendering aid?
I think the most important thing is that don't be afraid. And I can't say that enough, because I think, again, if you call 911 and you are trying your best to, again, perform hands-only CPR until help arrives, we know that, again, you're covered by Good Samaritan laws because you're trying to do the right thing and you're trying to help somebody. So, if you can push hard and fast in that center of the chest, 120 beats per minute, on an adult, you're going to try to push about at least 2 inches deep. So it's pretty deep. And people are, worried about, oh my gosh, am I going to break a rib? Am I going to hurt them? You can't hurt them, because guess what? They're already dead. And the only thing that can help them is you starting CPR and helping. What you're doing when you're doing CPR is actually acting like the heart. You're pumping that critical blood that has oxygen in it to the brain and all the other vital organs, so that when EMS arrives and they can come and help that person maybe restart their heart using an AED, that is going to help save brain function. And that's why it's so very, very important that somebody knows and starts CPR. Don't be afraid. Do what's right, and you will not get in trouble, I promise.
Comilla, give us a website where our listeners can learn more.
Yeah, so you know how I said you can learn in just a couple of a minute and a half, basically. So we have a great video that I'm going to ask every single person to watch. And then I'm also going to ask you to send this to everybody you know, because, again, most events happen at home, so it's going to be really important that everybody else around you knows what to do. So if you can visit heart.org/nation. So heart.org/nation. That's our Nation of Lifesavers campaign. You can find the video there to learn hands-only CPR. You can also find a playlist of all of the songs at 100 to 120 beats per minute. So that's how you know how fast to push if you're going to do hands-only CPR.
Dr. Sasson, I appreciate you joining us. Lots of great information, and I'm hoping that you'll return and speak with us again.
Well, thank you so much for having me, and really, you can save a life. All of us have that ability, and it just takes a few seconds to learn how to do CPR. So I hope everybody can join us and become a Nation of Lifesavers as well.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Comilla Sasson. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.